We're talking to Ms. Whitlow, and the topic is STD Free Coalition, and Ms. Whitlow is the director of the coalition. And of course, Ms. Whitlow, during the final segment here, let's see if we can have you to further inform our audience of all of the positive things in a real sense that the coalition is doing and has done, as well as perhaps point us a way in which we might be able to further use the information that you've gathered.
Thank you, Dr. Haney. I can't talk about the positive things that STD Free, the coalition, has been able to accomplish without talking about who our partners are. And specifically, our board chair is Melvin Bro with Project Hope, and then we also have members of our board from Hope Clinic for Women, and also the First Response Center that operates a wellness center and does prevention education as well. And the Metro Public Health Department, who is our contract agency, and the Department of Probation and Parole person sits on the board that is from that department, Metro Social Services also. We also have some individuals who represent radio stations. Sharon Williams, Sharon Kay, as she's known, is one of our primary persons that gets together with the coalition, and they've also done some hosting of some of our activities. By the way, which are National HIV Testing Day, that's one of our flagship activities. Also, something called, there's a lot of fun, called the STD Haunted House, which routinely for several years took place on the campus of Tennessee State University. That particular program is, in 2001, was the recipient of the Tony Cox Funding Award from the Cable Positive organization, and we're very proud of that. As well, that particular activity is replicated at sites across the nation. MTSU is a site that replicates that activity. The University of Alaska replicates that activity, and also a program, an AIDS service program in the District of Columbia, Washington, D.C., replicates it also. STD Free is a national, is a model program of the Centers for Disease Control. And because of that, it has also replicated the program itself. Is replicated in Memphis, Tennessee.
And so you're having an impact not only over the state of, not only in Nashville, but over the state of Tennessee and nationally in a real sense.
Well, I think that to the extent that that has happened and we've gotten some national recognition has been because we have had strong national partners. Project Wave was one of the partners in Project, which resulted in Project Wave Nashville here, which was a partnership between radio and STD Free, basically. And what we were able to accomplish with that was, I think, something that was kind of historic, and that is 3 urban radio stations who are fiercely competitive, sharing a stage under Sharon Kay's leadership and hosting to address the issue of HIV. And I don't know when that's ever occurred, and it happens every year at our National HIV Testing Day activity. So we're very proud of that as well.
And so in a real sense, you think that you might be able to bring some of the things that you're doing with STD into the HIV issue.
Well, we work with both issues. HIV, of course, is a sexually transmitted disease. So when we're working with syphilis and talking about chlamydia, we're also talking about HIV and AIDS as well. And I think that's something that's a little bit different from maybe some of the AIDS service organizations here in the city that have a primary thrust that's related to HIV and AIDS specifically.
And of course, Ms. Whitlow, the reason I say that is because I guess I've been talking to most of the individuals who have a primary concern with AIDS rather than say, even though, as you indicated, that it is an STD. But I guess, and for the most part, most of the pictures that have been painted in reference to this disease are very, very pessimistic kinds of pictures, which is to say that it's getting worse, and it's especially bad, HIV, I mean, and especially bad within the African-American community. And is that any validity in reference
Absolutely, and I think that it is something to be very concerned about. I think that there's less of a concern for sexually transmitted diseases, but one of the reasons that sexually transmitted disease in relation to HIV is so important and so important to be concerned about is because sexually transmitted disease, a person that has a sexually transmitted disease is more likely to get HIV or become infected with HIV, particularly syphilis. It facilitates very easily the transmission of...
It's a gateway.
Yes,
kind of
absolutely.
situation.
Yes.
Yeah. Very good. But the whole issue of AIDS, and that's how I think that we've dealt with the STD issue up until this point on this particular show. And I think other than since your visit with us in 98, 99, I don't think that we've done that much with STD as such. But
well, HIV, I don't want to take anything away from the issue of HIV. It is a very important issue, one that we deal with, and it is important particularly in the African American community because the rates have not dropped off as they have in some other populations. Women between the ages of 25 and I think 30, 34, it's the #1 cause nationally for African American women of death. It's not breast cancer. It's not some of the other ailments that you might think of, congenital heart disease or what have you. It's HIV for African American women.
In a real sense, Ms. Whitlow, that's the kind of information that we've been getting in reference to AIDS, that it is. Now, could you use what you're doing, the kind of outreach that you're having dealing with, I think because you deal with teenagers in reference to that, but do you ever, in a real sense, deal specifically with the AIDS issue, or do you just put them all together as you indicated, it is an STD? But do you sort of separate that to talk to them specifically about this disease?
When the case warrants, but we try to provide as much education about as many sexually transmitted diseases when the opportunity presents itself. So we want to talk about the whole cadre of sexually transmitted diseases, including HIV, to drive home the point of the importance of health and being sexually responsible with regard to all sexually transmitted diseases.
How has the public school system responded to this whole issue of STD, Ms. Whitlow, especially when we remember that for the most part, you know, people have difficulties dealing with sex and education and those kinds of programs in school?
Well, sexually transmitted disease is a part of the curriculum on that is part of the core curriculum in Metro. And so in that respect, you know, it's when we think about Tennessee, we don't sometimes think favorable on our educational system, but it is a part of the core curriculum, and those subject matters are taught. We frequently go to schools and talk about abstinence, and as well, schools come to our STD-free haunted house that occurs on Tennessee State's campus by the bus loads. So we can't say that in Nashville that we've been responsible. We probably need to increase
what you're doing.
The information that we provide to young people.
You know, over the last couple of minutes here that we have here, Ms. Whitlow, let's give you an opportunity to perhaps speak to some of those issues that you felt to be very, very significant in terms of your visit with us today that you might have had an opportunity to say anything about.
Well, I think one of the messages that I definitely would want your audience to know and be aware of is that sexually transmitted diseases, all of them are preventable. All sexually transmitted diseases, even HIV, are treatable. So I guess when an individual, perhaps if they have, you know, we ask all the time, well, why, you know, is there this issue of STDs when we know how to prevent STDs? But if, you know, if you've got 15 problems, certainly if you suspect that you have a STD, you don't want a 16th one. So people just prefer sometimes not to know. But what we want people to know is that treatment is simple as going to the Metro Health Department. Testing now is easy as taking for HIV as easy as taking an OraSure test, and it's quick, and many times it's free. So we want people to make the services at the Metro Health Department available, avail themselves of it, and as well seek out testing in these community type of situations where there's entertainment. The STD-free model is entertainment in the park and food, free food, music more, and then we also do some things around providing some incentives and T-shirts and that sort of thing for individuals. So that's our model, and we think we've been very successful with it.
And so you think you're doing a very, very good job in doing what you're doing, Ms. Whitlow?
I think our referrals and calls suggest that. People reach us by calling 297-0STD, and that's very easy to remember, or 297-0783.
Very good. And of course, Ms. Whitlow, let me thank you for bringing that excellent information by with us today. And let me encourage our audience to tune in again next week to another informative edition of Comments. Thank you, and